This is an early paper from 2021 that looks at exercise and face coverings, aka your masks. In 2021 and now, the present consensus is that the transmission of the virus primarily occurs through the ejection of virus particles from the respiratory tract of infected individuals, which can then be absorbed through the eyes, nose, or mouth of the exposed person. Transmission of these aerosolized particles may not travel that far, 6 to 9 meters, but there are also conditions where they may remain suspended in the air for significant periods. This could be like the California wildfires, or when you have high humidity environments, where the virus particles can then cling to the already existing moisture in the air, or to smoke and smog, and they'll remain in the air for longer periods of time, traveling further distances. And this is true especially in the absence of air turbulence, which is just a fancy way to say wind. However, larger droplets like spittle will land within a 1 to 2 meter range so much quicker. That basic 2 meter number is where we get that approximate 6 feet that was recommended early in the pandemic, but that's only for large droplet size. It's important to note that these can travel generally 6 meters from a person, which is about 20 feet from the individual. Furthermore, when athletes are exercising at high exertion, the particles can travel 10 to 20 meters. That's about 33 feet on the low end to about 67 feet on the high end. And again, that's droplet transmission without taking air turbulence into account. If you have highly turbulent air, things can travel farther. The authors note that the choice of face covering will profoundly impact heart rate, thermal stress, and subjective perception of discomfort. So if you have a tight-fitting mask that's very close to your face, you'll perceive that you are more uncomfortable. And this can increase your heart rate and be very hot and humid from your own breath. And when exercising, this increased retention of water vapor and sweat within the mask could impact the facial seal of the mask itself, but that's really only if you have an improperly fitting mask, which is why the choice of your face covering is very important. You get one that fits your face shape and face size. Another important thing is that the WHO defines a close exposure as 15 minutes. That's it. That's the requirement for high transmission. And they group this into a low grade, medium grade, and high grade transmission. So if you're outdoors for 15 minutes close to a person that's infected, you will be considered going from a high to a moderate level of transmission. Note, this is not a low level of transmission. Physical activities that are considered high risk include basketball, football, volleyball, indoor gyms, team sport training sessions, while low risk of transmission is individual running, singles tennis, and golf, where you stay away from people during the golfing session. And importantly, if you are using reusable face coverings, you should be washing it after every single use. Ideally, you're able to have single-use masks and throw them out, but if you are reusing, you need to wash after every single use.